Welcome to News from the Nations. My name is Brandon Beard and I'll be your host today. News from the Nations is a weekly broadcast from Children of the Nations. We broadcast on Facebook and YouTube. So glad to have you with us today. If you're watching this live or watching this later on, we are just so glad to have you with us. News from the Nations is a weekly broadcast from Children of the Nations where we highlight different countries where Children of the Nation serves, and we share stories of kids and staff and how they're being impacted and how they're showing love all around the world. You're going to hear some great stories today. You're going to meet some incredible people today. I can't wait for you to hear and see what's going to happen in this episode of News from the Nations. Listen, if you're just logging in right now, if you're just showing up and watching this, will you just go to the chat room right now and would you just let us know where you're watching from? And if it was me, I'd say I'm watching from Grapevine, Texas. That's where I'm coming from. You let us know where you're watching from. We would love to know where everyone is watching from and dialing in there. When you get into the chat room there and you start saying hello, you're going to meet a few people. You're going to meet Heather Fernandez. Heather is our marketing manager at Children of the Nation. She's been on staff for about 6 months. She will be in there. Heather, why don't you just say hello right now in the chat room? Let people know you're there. We've also got Bryce Clark in the chat room. Bryce has been on staff for a couple years. He's one of our community reps. Bryce is an incredible young man. He's in the chat room right now, introducing himself, I'm sure. So why don't you say hi to Bryce and get to know him? They'll be there in the chat room throughout this entire episode, just to let you know all about Children of the Nations, to share information with you, answer questions. They're there to pray for you, encourage you, whatever you need. Our team is here in the chat room on YouTube and on Facebook. So if you're watching us today, before we get started into the content of our show today, I just want to invite you to share this right now. If you would click on that share button on Facebook and put it out there and just say, hey, you want to smile, you want to hear some great news, come check out News from the Nations, Children of the Nations broadcast, and invite people to join us right now and be part of today's episode. We're going to be talking about something that's near and dear to my heart today. We're going to talk about nurses, and we're going to highlight some nurses who work in a country that's near and dear to my heart in Uganda. And the nurses we're going to talk about, I actually know them. I know them personally. I've been to Uganda many times, and so I'm so excited for you to meet them and hear about them and hear about some of the work that they're doing. I know it's going to just brighten your day. We've all been cooped up, right? If you're like me, we've been wearing masks when we go out, or we've been under quarantine, and we just kind of continue to pray and hope for that day that the quarantine is over. But for right now, we don't know what the future holds. And so we're going to do what we do each and every day here at Children of the Nations, and that's we're going to celebrate the life change that's going on. We're going to continue to love kids. We're going to continue to raise children who transform nations. That's really our goal. That's what this broadcast is all about. That's what this organization is all about. Now, I want to welcome those of you watching on Facebook or on YouTube. Again, my name is Brandon. It's great to have you with us. Those of you that just jumped in the chat room, let us know where you're watching from. We're so excited to have you here today. We're going to talk about nurses and the difference that they make here and around the world today. So excited for you to meet some of the different nurses that serve at Children of the Nations. So with no further ado, let's get into our content today. Welcome to News from the Nations. Welcome to News from the Nations. My name is Brandon Beard. I'll be your host today. News from the Nations, as I said earlier, is a weekly broadcast from Children of the Nations where we take you to different countries and we highlight the different things that this organization is doing all around the world. They're raising children who transform nations, and they're making a huge difference. Today, you're going to be so encouraged because you're going to meet some nurses. We're going to highlight some of the nurses and the work that they're doing to provide holistic care to our kids, specifically in the area of medical care. Our nurses are amazing in all of our countries. I've seen nurses help amputees in Haiti. I've seen nurses care for kids in the Dominican Republic. I've personally been to the Children of the Nation sites there, and I've also seen the nurses, and I know the nurses in Uganda. And we're going to specifically look and meet some of those nurses in Uganda today. I want to tell you about these nurses. First of all, their names are Nurse Olivia and Mama Milber, okay? Nurse Olivia and Mama Milber. I want to put some pictures of them on the screen right now just so you can know what they look like and who they are. And what you're going to notice about them is their smiles. And if you just look in someone's eyes and you look at their smile, you know there's something special about them. When you meet these nurses, you know that they are not, making some big, huge paycheck. No, they've committed their lives to work with orphan and destitute children, and they love these kids. And when you're on campus in Uganda, if I could take you there right now and we were to walk the campus in Uganda, what you would see these nurses doing is you would see them caring for kids. You would see them sitting down with kids. You would see them at the clinic praying for kids and giving them the medical attention they need, taking them to the hospital when they have malaria or when they are sick or they have a really serious issue, just providing incredible care. So Mama Melba and Nurse Olivia, we're so thankful for them. I know that they're actually going to see this video. So in the chat room right now, would you just put that clapping hands emoji, or even right where you are right now, if you just feel like going, thank God for people like Mama Melba and Nurse Olivia. So right now, what I want to do is this. I want to take you on a tour of our medical facilities in Uganda. And what you're going to see is they do a lot with very little. Let's go to Uganda right now and take a tour of the Children of the Nations medical facilities.
So you're welcome to COTN Uganda Clinic. I am Akelo Olivia and I am the head nurse, and this is
Mama Milber. I'm the nurse and also the mother.
Yes.
COTN Uganda.
Okay, so thank you. So this area you see here is our triage area. We basically have educative posters, as you can see. We have a big notice board that has emergency call numbers, that has some of the articles in the standard of service, and we have waiting area for the children. So we basically see one child at a time. This is section 2 of the clinic. It's basically our pharmacy. It's like our dispensary, and it's also where we see every sick child. And so we see one child at a time, except for the very little ones who are brought by the teachers, and they sit over here.
Then we also have our food supply. We have the juice there for the sick ones, those ones who are on anti-malarial treatment. We give them. The splash is there,
Biscuits,
the biscuits is there,
and sweets
are
for the
also
little
there
ones.
for the little ones, so that they don't fear medicine.
Yes. And we have safe drinking water down here for the children. We have a hand washing facility. The water is treated with AquaSafe so that it is safe for their use. This is hand washing facility with soap. And as you can see, we have curtains all over. We want to ensure privacy so that each child is seen. But the biggest challenge we have as per now is that the drugs we have here are not enough for this entire population of the children. And so we usually request that when teams are coming, they can bring for us, for example, albendazole, ciprofloxacin, and the like. Such help us in treatment of these children.
Azithromycin.
Even azithromycin, cotton balls, any other hospital supplies, we always use them. We are grateful for those who have been supplying us in the past years. The last section of the clinic, and it's our laboratory. As you can see, the laboratory is so lacking. It is very lacking, and so most times we meet extra costs of having to take the children out so that they are properly diagnosed before we can start treatment. All in all, we are grateful for the support that the teams have been giving this clinic. The face of this clinic is changing day in and day out. It is growing, and we hope to see it much bigger and better, so that we can be able to give better services to our children, so that they become children who can transform nations, but in good health. Thank you.
Thank you very much.
Mother Teresa says, in this life, you cannot always do great things, but you can do small things with great love. I love that quote, and it reminds me of the clinic that you just took a tour of, the medical facilities there in Uganda that the nurses and doctors there use to care for all those kids. They don't have much, but what they have, they serve and provide for those kids with great love and tremendous care. But they also, nurses like Mama Melba and Nurse Olivia, who are there in Uganda, who are both dear friends of mine, they need your help. They need our help. They need help with supplies. They need help. You can see from the video, they need resources. That's why our emergency health fund is set up to help them. Not just fight COVID-19, but provide ongoing care. As far as COVID-19 goes, we want to provide emergency supplies to them. We want to supply them with things like hand washing stations and masks and gowns and things like that. But we also want to help them with the medical supplies they currently are short of and have needs of. So go to donate.cotni.org /emergency-response. That link is going to be in the chat room right now. And if you click on that link, any amount, you can do small things, right, with great love. Any amount is going to go directly to helping nurses like Nurse Olivia and Mama Milber. I hope that you'll give to the Emergency Response Fund today and help as we fight COVID-19 in all these different countries where Children of the Nation serves. But specifically, we want to provide these nurses with the supplies they need to protect themselves and care for these kids in a powerful way. Now, speaking of doing great things, I want to introduce you today to Ashley Van Brunt. Ashley Van Brunt is a registered nurse. She's our physical care specialist here in the United States and works with all of our different countries and helps train them and provide resources to them. She wants to share with you today, and I'm excited for you to hear from her. She wants to share some of the great efforts that are being made by our nurses in our different countries. She's going to share a story about Nurse Olivia in Uganda, but she's also going to share with you a little bit about the level of care that is provided for our kids in Uganda. And it will give you a picture of the level of care that's provided in all of our countries. I can't wait for you to hear from Ashley Van Brunt right now as she shares with us.
Hello, my name is Ashley Van Brunt. I'm a registered nurse and physical care specialist for Children of the Nations. I first joined COTN in 2013 when my husband and I both volunteered in Sierra Leone's medical clinic. We did this over a period of 3 years, and our hearts were captivated by seeing God truly transform children's lives. It was in 2016 that I joined staff with COTN. And in COTN, we believe that a tangible way to show a child God's love is through responding to their physical needs, their environment, their hunger, their medical need. We focus on providing high quality physical care programming to all the children in our program, but we also focus on the individualized, unique need of every child. There's so many stories that I want to tell you that capture this, but one that comes to mind is a story from Uganda. Our head nurse, Olivia, provided amazing advocacy for a girl in need. Her name was Deborah. She was high school aged and sick with HIV. Her disease left her ashamed and so isolated and stigmatized. She was suffering emotionally, spiritually. She could no longer do her studies in school because of her sickness. And out of desperation one day, she finally went to Nurse Olivia and Uganda's clinic. She was met with compassion, comfort, and skilled advocacy. Nurse Olivia made sure that she went to the local clinic and hospital that would bring her up to speed for all of her treatments. Nurse Olivia also ensured that she had the specific nutritional needs based off of where her body was at then met. And she empowered this young girl. Deborah is now stabilized, she's well, she's confident, and she's back in school. And it was such a beautiful thing to see Deborah transform through the advocacy and physical care provided by COTN Uganda. And there are so many more stories like this, but what I'm so thankful for today is that this advocacy has continued even during the pandemic. COTN Uganda, as they are making plans for COVID-19, made specific arrangements for every child like Deborah with complicated and chronic illness, ensuring that even in this time that their emotional, spiritual, and physical needs would be met. This is the caliber of amazing work that all of our countries are doing right now.
I love that you just got to hear from Ashley Van Brunt, our physical care specialist. She has a huge heart for kids and for this organization, Children of the Nations, and what she shared just represents what Children of the Nations is all about. Whenever I talk about Children of the Nations, I always tell people it's not a relief organization. They don't just drop off resources and then leave. No, they stay and they build relationships and they provide holistic care. And her story about Nurse Olivia helping Deborah, this teenager who was facing some of the biggest health challenges of her life, just inspires me and encourages me. And I hope it encourages you to know that what Children of the Nations is doing around the world is making a lasting impact. That's really what it's all about. And so they serve in 5 different countries. And what I want to ask you to do today on our show today is I just want to ask you to pray and commit to pray for one of the countries where Children of the Nations serves. So I'm going to list off the countries, and whichever one just kind of sticks out to you and you would be willing to say, you know what, I'll pray for one of those countries this week, will you just type that country's name in the chat room and just say, I'll commit to pray for the nurses and the kids, and that they would be protected from COVID-19, and that they would get the resources that they need to take care of these nurses and doctors and also these kids. So here's the countries where Children of the Nations serve. They serve in Sierra Leone, Malawi, Uganda, the Dominican Republic, and Haiti. We're based here in the United States, Children of the Nations is, but serves in those 5 different countries and serves orphan and destitute children. The vision is to raise children who transform nations. And I just believe with all my heart that Deborah, who Ashley just talked about, she's going to live out that vision. She's actually living out that vision and mission right now in her own life. So I just want to remind you once again, you can give to that emergency response fund. You can click on the link in the chat room and just be generous in any way that you can give. It's going to make a difference. It's going to help Nurse Olivia. It's going to help Deborah. It's going to help Mama Melba. It's going to help nurses and doctors and our medical staff in all 5 different countries as they fight COVID-19 and provide love and care for these kids. Now, each and every week as we end News from the Nations, we always like to leave you with some smiles. And so right now, as we leave, I don't want you to sign off right away. I want you to watch this video of some kids singing and the joy on their faces. This video was obviously taken before we had to social distance. So let's just enjoy the look on these kids' faces and the joy of them singing as you go off today. And we'll see you next week for another edition of News from the Nations.